Assalamu alaikum class. How are you? Hope you have a good health and you are enjoying these days. Who is present at this time? Can you please send me your name? इसमें शो नहीं हो रहा मेरे पास. अटेंडेंस पे अगर मैं देखूँ प्लीज. Can you please hear me? आपको मेरी आवाज़ आ रही है बिल्कुल क्लियर? Can you please respond this? Okay, the Ifra, Salim, Sahara, Rooj, Sadia, Julius and Sidra, Jameel. Okay, good. Where are the rest? Ifra, Salim, Julius, Ifra, 2 times Islam, Islam and Sahara, Rooj. That's great. Okay, let me first of all थोड़ा सा मुझे आपसे शिकायत ये है कि मिस मैविश की भी क्लास थी, ठीक है. तो जब कोई टीचर आपसे कुछ क्वेश्चन पूछता है तो वो एक्सपेक्ट कर रहा होता है कि उसको टाइमली आंसर करना होता है, ठीक है. देयर आर मैनी, जिसमें बहुत सारे हो सकते हैं कि रीजंस हो सकती हैं आपसे क्वेश्चन पूछने का. हो सकता है कि वो आपकी प्रेजेंस को देखना चाह रहा हो टीचर, ठीक है. तो मैं आपको एक बात बताता चलूं कि ये हमारे सारे लेक्चर्स जो होते हैं वो रिकॉर्डेड होते हैं, ठीक है. सबका हमारे पास एविडेंसेस होता है कि हम जो कुछ आपसे पूछते हैं, ठीक है, जो कुछ आप बताते हो वो हमारे पास उसका रिकॉर्ड होता है. एक कंटिन्यूसली टीचर एक पूछ रहा है, आपसे पूछी जा रहा है, बट यू आर नॉट रिस्पॉन्डिंग, यू आर नॉट गिविंग एनी रिस्पॉन्स, इट्स मीन यू आर मेकिंग द ट्रबल विद यू, ठीक है. इसमें ये है कि मेरे पास एवेल्युएशन आएगी, मैं कहूँगा ठीक है जी, अब रिजल्ट मेरे सामने पड़ा हुआ है, ठीक है. बहुत हालात जो है ना बहुत सारे ख़राब है. मैं आपको बता दूँ, पता नहीं क्या वजह है. ये कोरोना की वजह से मैं आपको बताऊं कि ये तो बड़ी रिलैक्सेशन हुई हुई है आजकल. वेयर इज हबीबा खान? ओके, कोरोना की वजह से तो बहुत ज़्यादा रिलैक्सेशन है, ठीक है ना. आप कॉलेज जाते हो, हॉस्पिटल जाते हो, तो हॉस्पिटल एक ही ड्यूटी है ना, तो 3 घंटे तो आपको कंटिन्यूसली देने चाहिए. आपका मिड टर्म एग्जाम अच्छा नहीं हुआ, आप जो आपके डेली टेस्ट होते हैं आप सब उसमें पार्टिसिपेट नहीं करते हो, आप डेली लेक्चर्स में आपकी पार्टिसिपेशन नहीं होती है. ये चीज़ें देखें बहुत जो है ना, हमने 85 के बैच पढ़ाए हैं, हमने BSN को पढ़ाया है, ठीक है. बट with sorry to say with this class experience is being very worse. all of सिर्फ मैं अब एडवाइज़र हूँ, मैं इस तरह की वर्डिंग यूज़ नहीं कर सकता हूँ. being worse to me, हर लेक्चरर मुझे यही कहता है कि सर आप देख लें. जैसे मैंने क्या देखना है, मैंने तो कहा है कि 1 नंबर से आधे नंबर से भी है तो फेल कर दें इनको, ठीक है. ये रिजल्ट अब प्रिंसिपल साहबा के पास हम अगर भेजेंगे तो ये तो बहुत एम्बैरेसिंग है रिजल्ट. मैंने तो बना के सारा, ये अगर आपको नज़र आता हो तो मैंने तो सारा बना के प्रिंसिपल साहिबा को फॉरवर्ड कर दिया, ठीक है. इसमें क्या, ओके. सबसे पहले आसमा खलील प्रेजेंट है. आसमा साहिबा, वेयर इज आसमा? हाँ जी, मेरे ख्याल में आसमा साहिबा नहीं है. आसमा को मैसेज दे दीजिएगा, शी इज फेल इन रिसर्च, ठीक है. आबदा परवीन, वेयर इज आबदा? Abda is present here. Abda, Aslam, you're very lucky. Whenever I speak your name, you are present. But yes, Abda Parveen, you are very lucky because you are a pass in all subjects. You got a 76% marks. That's a good. It's been you have a different approach. Habiba Wan, where is Habiba Wan? Yes, Habiba Wan is present. Habiba Wan, you are also pass in whole subjects. You secure 84% marks. That are very good marks. and raise a hand to congratulate Habiba because she had a high percentage from all of you, your class. Yes, Habiba, congratulations. You got a very good marks. And Ifra Salim. Ifra Salim, you are present right now. Ifra Salim, you are fail in ICU Viva and ACN as well. Because I don't know the health assessment ACN paper was not too much tough. I think so. It was a much easier if you have attended by all of the lectures. Then I think so. It was not a big deal to solve these questions. Okay, Ifra, have you write down Ifra that you cannot qualify ICU Viva and ACN subject as well. And Julius Messi, where is Julius? Julius, you are present. I think so. You are just present in a from the beginning of the class, and then you are absent, and then and the last you comes when the lecture is being ended. Julius Messi is present right now. Yes, Julius was present in first 5 minutes. Julius, yes, you are present, but I want to make sure that you are present. Julius, you are fail in multiple subjects. You are fail in ICU, you are fail in ACN, and you are also fail in a micro. That are very, very, you can say, it's mean the ICU subject is not being taught as you want. Our ACN teacher is not much competent. He is failed to make you understand better. And micro teacher is not, I think, uh, she is not competent that can you understand in a better way. You think so? Lubana Kalsoom. Lubana is present. लुबाना लुबाना कलसूम के भी हालात बहुत ज़्यादा अच्छे नहीं हैं. ICU वाइवा, शी फेल इन ICU वाइवा health assessment and ACN as well. Who is a 8th student who just come. Lubana is still absent. And Neelam Aisha. Neelam is present. Neelam Aisha is also absent. Ronald David. Ronald, I think so. What is going on with the Ronald? Ronald is also absent in a patho exam. Okay, if he was absent, he can make a schedule his exam as well with Sir Mehdi, because absenteeism is not bearable in any exam. No? It is considered failed. Aslam, Asma Khan, you are late 10 minutes. Okay. Asma Khalil, you are Asma Khan, you are Asma Khalil. Asma Khalil, you are fail in a research. Sadia, Yasmin, where is Sadia? सादिया इज प्रेजेंट? सर उसकी न्यू बॉर्न बेटी की डेथ हो गई थी उसी। ओके, अल्लाह पाक उसको जन्नत में जगा दे। हाँ, उसको बहरहाल जब वो आए तो उसको चाहिए कि क्या जल कर सकता है अपना एग्जाम जो है ना। ठीक है। अच्छा, सादिया यास्मीन, सादिया यास्मीन, you are where is Sadia Yasmin? Yes, Sadia, you got 76% your pass in all. I appreciate your understanding. And who is a Sahara Roach? Sahara Roach is present. Sahar Aruj. Yes, she is present. Sahar Aruj. आसमा खान फेल कौन क्या सर? मैं फेल हूँ क्या सर? यस सर। आसमा खान, you are fail in a research. And Seher Aruj, you got 75% marks. You are pass in all. Okay. And Sidra Jamil. Sidra Jamil is present. Let me. Sidra Jamil is present. Yes. Sidra Jamil, you are fail in a health assessment. हेल्थ असेसमेंट का एग्जाम टफ था या आपने उसको टफ बनाया हुआ था? आपकी अटेंडेंस में यहीं से ले लूँ इफ्रा? आप बता सर। हाँ, किसकी प्रिपरेशन नहीं थी तो करनी थी ना, आपको पता नहीं कि एग्जाम है? विदाउट प्रिपरेशन आप कैसे बैठ गई एग्जाम में? हबीबा वान, सादिया, जूलियस, 8 स्टूडेंट स्टिल यू आर प्रेजेंट। प्रिपरेशन नहीं थी उसकी तो सिद्रा, ये तो प्रिपरेशन आपने करनी होती है ना। ओके, लेट मी शो समथिंग टू यू। अगर मैं एक फाइल को अपलोड करूं तो इधर हो जाएगी। Sorry sir, next time be careful. You will be careful or I? Sure. Yes, you will be very careful because एक दफ़ा जो रिजल्ट ख़राब हो गया ना वो बड़ा प्रॉब्लमेटिक होती है एक चीज़। अच्छा, दूसरा क्लास ये कि मैं आपसे एक शेयर कर रहा हूँ एक डॉक्यूमेंट्स, क्या वो ओपन होता है आपके पास मोबाइल में? देखिएगा उसको ओपन होता है फाइल कि नहीं होती। cannot open. Okay, let it be. अभी वो शेयर हो रही है, कितनी बड़ी फाइल है? अगर ये शेयर हो जाए तो बहुत ज़बरदस्त चीज़ है ये। ओके, मैंने वैसे शालामार ई लर्निंग पोर्टल जो है उस पर एक है ना मस्कुलोस्केलेटल सिस्टम डॉक्यूमेंटेशन के नेम से मैंने ना एक फाइल मैंने आपको शेयर कर दी हुई है, ठीक है। उसको आज आपका काम है कि उसके प्रिंट आउट लें, उसे मोबाइल पे पढ़ें, सीक्वेंस मुझे हर हालत में आपको जो है ना उसको मेमोराइज करें। शेयरिंग हो रही है अभी तक। यस, दिस इज सर। ओपन हुआ है? क्या ओपन हुआ है? हो गई ओपन? If it is open, then let me know, please. Yes. सादिया, can you please सबके पास ओपन हुई है कि नहीं हुई है? ये फाइल मैंने जो भेजी है, all of you should open it in your mobile phone or laptop or PC in front of you are sitting. Yes, सादिया, सब ओपन हुई है? जूलियस, ओपन हो गई? आसमा खान, नो। हो गया है ओपन सर, गुड। इफ्रा, ओपन हो गई है सर, ओके, दैट्स ग्रेट। अच्छा, ये मैंने आपके लिए ना डिफरेंट बुक से ऑब्वियसली हम हेल्प आउट लेते हैं, डॉक्यूमेंटेशन फॉर्म फॉर यूज इन द प्रैक्टिस। वैसे बहुत अच्छा हो जो स्टूडेंट्स काम कर रहे हैं अपने क्लिनिकल एरिया पे, जो कि ड्यूटीज पे जो जाते हैं। नहीं हुआ सिदरा जमील, मेक इट ट्राई। नहीं हो रहा ओपन, असमा खान का नहीं हो रहा, सिदरा जमील का भी नहीं हो रहा। ओके, आपदा का तो इनका लगता है मोबाइल अच्छा है, या बाकियों का तो ओपन हो गया। अच्छा, मैं इस फॉर्मेट को थोड़ा सा आपसे डिस्कस करना चाहता हूँ। अच्छा, अगर नहीं हुआ ओपन, डोंट बी वरी, यू कैन प्लीज ओपन इट फ्रॉम द शालामार ई लर्निंग पोर्टल, ठीक है। ई लर्निंग पोर्टल पे मैंने इसको जो मस्कुलोस्केलेटल सिस्टम डॉक्यूमेंटेशन फॉर्म के नाम से इसको ना किया हुआ है, ठीक है। अच्छा, सबसे पहले देखें जी, हेल्थ हिस्ट्री ऑफ अ मस्कुलोस्केलेटल सिस्टम। पेशेंट नेम आता है सबसे पहला, और डेट एंड टाइम, ओवरव्यू, आइडेंटिफाइंग डाटा, सोर्स एंड रिलायबिलिटी। अब जो कुछ हमने पढ़ा हुआ है ना, उसको हमने एक सीक्वेंस में लेते हैं। कॉमन एंड कंसर्निंग सिम्टम्स, ओके, आप मेरे साथ हैं ना, पढ़ रहे हो वैसे ही है, ठीक है। कॉमन एंड और कंसर्निंग सिम्टम में सबसे पहले जॉइंट पेन एसोसिएटेड विद systematic symptoms such as a fever, chills, rashes, weakness and weight loss. You have a low back pain, you have a neck pain, you have a bone pain, you have a muscle pains or cramp, you have a muscle weakness, its onset, its location, its duration and characteristic symptom, associated manifestation, its relieving factor and treatment. ओके, ये एक जो है मैं आपको बड़ा एक अच्छा फॉर्मेट दे रहा हूँ कि अगर आप परफॉर्म करने जाते हो मस्कुलोस्केलेटल सिस्टम, तो आपके पास एक पूरा फॉर्मेट होता है, या आप इसी को ही सिर्फ फिल कर लें तो आपकी मस्कुलोस्केलेटल सिस्टम असेसमेंट पूरी हो जाती है। मेडिकेशन करंट एंड द मेडिकेशन पास्ट योर क्लाइंट इज यूजिंग। Muscles are bone disease if any patient is suffering, or muscles are bone disease in past if he had been उसको कोई डिजीज रही है। फैमिली हिस्ट्री में मसल्स आर बोन डिजीज, डायबिटीज हमने पढ़ा था कि कौन कौन सी डिजीजेस में मस्कुलोस्केलेटल जेनेटिक जेनेटिक टेस्टिंग, लाइफस्टाइल हैबिट्स, इट्स अल्कोहल, फिजिकल एक्टिविटी पढ़ा था हमने। ठीक है, आप सबसे एक्सपेक्ट ये मैं कर रहा हूँ कि आप मुझे रिस्पॉन्ड करते रहेंगे साथ साथ, ठीक है। ओके, फिजिकल एक्टिविटी एंड फिजिकल एग्जामिनेशन। फिजिकल एग्जामिनेशन इंक्लूडेड ओवरव्यू, मसल्स बल्क, मसल टोन एंड मसल स्ट्रेंथ। ठीक है, हमने फिजिकल एग्जामिनेशन में मसल्स बल्क बेसिकली देखना है, मसल्स टोन एंड मसल स्ट्रेंथ। देन टेम्पोरोमैंडिबुलर जॉइंट से सबसे पहले टेम्पोरोमैंडिबुलर जॉइंट पे आते हैं। मेरे पास ना अभी एक बड़ी खूबसूरत सी वीडियो है, दिस इज अ वेरी शॉर्ट एंड कंसाइज वीडियो। ठीक है, मैं आपको वो दिखाता हूँ कि बहुत मजेदार वीडियो है। Temporomandibular joint is inspection for the joint symmetry, alignment, its bone deformity, inspection and palpation of the surrounding tissue for the skin changes, any nodule, muscles, atrophy and crepitus, any range of motion and maneuvers to test joint function and stability and integrity of the ligaments, tendon, its bursa, especially if a pain or the trauma. Assessment of the inflammation or arthritis, especially swelling, warmth, tenderness and redness. Assessment of a muscle strength. मसल स्ट्रेंथ आप टेम्पोरोमैंडिबुलर जॉइंट की देखो या ना देखो, वैसे क्लिनिकली इतनी सर what we have to do with this document, memorize or make a research for of it. Achha, this is not a performer like research. You can please, if you have tomorrow you have a time in your ward, you have to just spend 20 minutes, you have to get this performer and perform this. अच्छा, आप एक स्टूडेंट एक दूसरे के ऊपर भी कर सकते हो, आप स्टूडेंट एक दूसरे के ऊपर भी ये परफॉर्म कर सकते हो। ठीक है, आप उस सीक्वेंस पे चलते जाओ। यस, शी इज द पेशेंट एंड इसकी एज इतनी है, आप वो फाइंडिंग्स जो है ना साथ साथ में लिखते जाओ। दिस इज अ परफॉर्मर फॉर यू। एक्चुअली यू हैव टू गेट द प्रिंट आउट ऑफ दिस एंड यू हैव टू मेक अ पोर्टफोलियो कि आपको हेल्थ असेसमेंट की ये मैंने जो है ना आपको असाइनमेंट दी है। ठीक है, और इस तरह से आपने इसको फिल किया। This really makes you very helpful. The shoulder, inspection for the joint symmetry, alignment, bone deformity, shoulder पे आ गई जी। Inspection and palpation of the surrounding tissue for the skin changes, any nodule, any muscle atrophy or crepitus, range of motion and the maneuvers to test joint function and stability and integrity of the ligaments, tendon, bursa, especially if pain or the trauma, assessment of the inflammation or arthritis, especially swelling, warmth, tenderness and redness. Assessment of the muscle strength. Yes, shoulder की किस तरह से muscle strength चेक करते हैं, मैं अभी आपको एक वीडियो दिखाता हूँ, उसमें सारी muscle strength किस तरह से चेक करते हैं। The elbow, elbow पे फिर आ गए, आपने इंस्पेक्शन पहले सबसे पहले जॉइंट की इंस्पेक्शन करनी है, सिमेट्री, अलाइनमेंट और द बोन डिफॉर्मिटी। Inspection and palpation of the surrounding tissue for the skin changes, its nodule, muscles, atrophy, crepitus, range of motion and maneuvers to test the joint function, its stability and integrity of the ligaments, tendon, bursa, especially if the pain or the trauma. Assessment of the inflammation. ये सारी चीजें जो है ना मस्कुलोस्केलेटल सिस्टम में सब में हमने देखना होगा। हमने इन्फ्लेमेशन भी देखनी है, मसल स्ट्रेंथ भी देखनी है, कोई ट्रॉमा तो नहीं हुआ, कोई स्टेबिलिटी, इसकी इंटीग्रिटी, लिगामेंट्स को देखना है, टेंडन को देखना है, बर्सा को देखना है, क्रेपिटस, एट्रोफी, नोड्यूल, कोई स्किन चेंजेस, क्या कोई बोन में कोई चेंजेस, उसकी सिमेट्री, ये सब में हमने क्या है वो इक्वली देखना। हबीबा, यू गॉट इट, थैंक यू। अच्छा, द रिस्ट एंड द हैंड, वही चीजें आ गई, रिस्ट एंड हैंड में सारी चीजें वही आ गई। दिस स्पाइन, स्पाइन पे आ जाते हो आप। ठीक है, फिर आप हिप पर आते हो, फिर आप नी को देखते हो, फिर एंकल एंड फुट को देखते हो। दिस इज ऑल द असेसमेंट सीक्वेंसेस। देखो, आप हेल्थ असेसमेंट में समझता हूँ कि बहुत इजी सब्जेक्ट है। ठीक है, सबसे पहले तो आपको थोड़ा सा पता होना चाहिए कि कौन से सिस्टम की एनाटॉमी कैसी है, नॉर्मल चीजें क्या हैं, एबनॉर्मल क्या है। ठीक है, क्या करना है, कहाँ करना है, कैसे करना है। सीक्वेंस आपको पता होना चाहिए। एग्जामिनर आपका आया बैठा है, वो ज़रूरी नहीं है कि अगर आप आईसीयू के स्टूडेंट हैं तो वो आपको कहता है कि आप जी रोड ट्रैफिक एक्सीडेंट हुआ है, मस्कुलोस्केलेटल असेसमेंट मुझे करके दिखाएं। हो सकता है ना, रोड ट्रैफिक एक्सीडेंट हुआ है, पेशेंट क्रिटिकल है, जी करें जी मस्कुलोस्केलेटल सिस्टम असेसमेंट मुझे करके दिखाएं, हेड को किस तरह करते हैं। आप कहें नहीं जी वो तो उसका तो आपने हमसे लेना ही नहीं है, तो एग्जामिनर को तो आप ये तो नहीं कह सकते हो कि ये तो आपने मुझसे पूछ ही नहीं सकते हो अपनों। ठीक है, सीक्वेंस आपको पता हो, दिस इज वेरी सिंपल। जब सीक्वेंस वाइज से आप शो होते हो, डिमॉन्स्ट्रेट करना, देन इट गिव यू गुड मार्क्स। ठीक है, अब शुरू से कह दो सर ये तो मैं एक्सपेक्ट नहीं किया जा रहा और ये आप हमसे पूछ नहीं सकते, तो एग्जामिनर है ना। ठीक है, अच्छा किसने भेज दिया, ये क्या भेजा भाई ग्रुप में? अच्छा ग्रुप में आपने परफॉर्मर भेजा, वेरी गुड, हु मेक दिस एफर्ट? जूलियस, वेरी गुड, ओके। अच्छा मैं अब आपको एक ना वीडियो दिखाता हूँ। क्लास सारे मुझे जरा यस की वो दें, साइन दें। अच्छा 1 2 3 4 5 6 6 पीपल गिव रिस्पॉन्ड। मैं अटेंडेंस भी इस हिसाब से ले रहा हूँ आज। 7 8 8 पीपल, 1 is missing। 1 2 3 4 5 6 7 8, एक बंदा अभी मिसिंग है।
Today we're going to talk about musculoskeletal exam. So what we're going to be doing is inspecting each joint, and then we're going to be palpating it, and then assessing the range of motion, and then the strength under range of motion. So we're going to start with the jaw. And now for the jaw, we're actually not going to test strength by no bite. Don't let the patient bite you. Okay. So first we inspect the jaw.
क्लास आपको आवाज आ रही है क्लियर बिल्कुल वीडियो की? आप द लेटर, कैन यू प्लीज hear the voice and video as well clear? Okay, great. Yes ma'am, yes sir.
Joint both sides. Open your mouth please and bite down. All right, so we assess the strength of the masseter just by feeling, but we're not actually going to have them, bite down. That'd be bad. To assess strength of the sternocleidomastoid, we're going to ask the patient to turn their head from side to side. So look to the right, look to the left, look up and down. And then we can also have them do that against resistance. Turn your head, push forward and pull back. One important thing here is that when you do this to the side, they're not pushing this way or this way, but actually turning their head against your hand, because that's the real function of the sternocleidomastoid there, is to turn the head, not necessarily to push to the side. Next, we do shoulders. So the shoulder is formed by the acromioclavicular joint, the acromion in the front, the acromion in the back coming off the scapula, the clavicle in the front, and then you've got the glenohumerus coming in from the bottom. So basically what we're going to do is we're going to take our fingers, we're going to palpate around the AC joint, and then palpate over the top. Is there any tenderness as I do that? And then you can do that for both sides. You also want to evaluate the level, the elevation of both of their shoulders, because they may have a little bit of scoliosis. So We've looked at that. Next, we're going to do range of motion. So what I want you to do is bring your arms to the side. Now, if you go directly above this, patients are going to become impinged, so you don't actually have them do that. So bring your arms back down to the side. That's abduction. That was adduction. Now bring your arms straight up. This is flexion. Bring your arms up overhead. And that is flexion above the head. Now, the last thing we need to test is internal and external rotation. So we're going to ask the patient to do this. Jeez. And you're going to see if, how close they can get their fingers together. If they can touch their fingers, that's very good range of motion. And the other side, please. All right. So by doing that, the patient is flexing the left and then externally rotating. And then she's extending the right and internally rotating. So by doing that on both sides, we're doing flexion, extension, and internal and external rotation at the same time. All right, next we're going to assess strength. So first step is ask the patient to shrug. Push your arms out, pull your arms in, bring your arms straight out, push out, and pull in. Okay, next we're going to do the elbow. So for the elbow, we're going to inspect and palpate the elbow. Sometimes patients will have a large fluid right here, which is a bursitis, and sometimes it'll be red and inflamed. So we're going to palpate both sides of the elbow. Now, this part right here is called the lateral epicondyle. This part right here is called the medial epicondyle. You want to palpate both of those for tenderness. If there's tenderness on the outside, that's tennis elbow. If it's on the inside, that's golfer's elbow. So we do that with both elbows, and then come down to the wrist and inspect the wrist. Is there any tenderness here? Now, carpal tunnel syndrome is caused by the median nerve running through the little tunnel formed by the carpal bones. And so sometimes that can cause weakness and tenderness and tingling. So you can tap on the patient's wrist like this. That's called Tinel's sign. Does that cause any numbness or tingling? The other thing you do is ask them to bring their hands together like this and bring the wrists together. And that's called Phelan's sign. So if either of those causes numbness or tingling or weakness, that would be positive for carpal tunnel syndrome. Next, we're going to assess the strength of the elbow and the wrist at the same time. So make a fist like this, push outwards, push, 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 and pull inwards. Okay. Assessing for range of motion of the elbow is important because if the patient can't do this, they can't eat. So bring your hand to your mouth and the other side. This patient is not going to die of starvation. Next, we have the fingers. So we're going to palpate each joint individually. And you can do that both sides and ask the patient to squeeze and let go. And let go is an extremely important command because otherwise some patients may stay there trying to crush you. And one mistake that you should never make is say, squeeze as hard as you can. Because I've had patients where you squeeze, they're like, as hard as you can. They take it as a challenge to destroy you. So be careful about that. So now we've done all of the upper body, and now we're going to move on to the lower body. So for the hips, we're not really going to inspect and palpate the hips, but we are going to assess a little bit of strength. So you need to use your hand to stabilize the patient's back and ask them to press up. And then other side. So if you do this without stabilizing, then what's going to happen is they're just going to be trying to lean back against you. So pull your knees up. See, it doesn't really work that well. You can also assess hip strength by asking the patient to lie down. So let's go ahead and lie down. And what you can do is have the patient like this, one hand holding on to their ankle, other hand on the knee. And pull your knee up, please. Pull, 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 pull. And then you can come around to the other side and push, 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 push. So you've got to be careful here, especially on an exam table. They can push themselves right off the table, so don't do that. And then you can also check for external and internal rotation. Okay, go ahead and sit up, please. Next, we have the knee. So for the knee, any chance you can pull up?
There's no chance.
No chance.
I don't think.
Yeah.
How?
Maybe we'll have to use my knee as a model.
Yeah, mine's not going up.
I don't think I can.
Oh, there you go.
I can't.
Not, it doesn't work. All right, how's my knee model here?
I gotta put it down then.
Let's get a close-up on that puppy.
The sock comes off.
All right.
Alright.
Okay, so with the knee, you've got medial and lateral. So this muscle is known as the vastus medialis. And what you want to do is you want to palpate above and below the patella and then press down on the patella. Some patients have an issue where the patella doesn't groove correctly in the tibia, and when that happens, it can wear down the inner surface of the cartilage. And when you press like that, if they have tenderness there, that can be an issue. So we're going to be palpating above and below, and then you also want to palpate around the joint line itself. We'll do a cutaway to that. We don't know whose knee that is. Okay.
Yeah,
Yeah.
sit down so your face is in it. There you go. That's better. Okay, you're good.
All right. So for the knee, we're going to palpate the joint line, starting in the back, moving around toward the front, and we're going to palpate below and above the patella. And then we're going to press in on the patella. Sometimes there's patients who have a wearing away of the cartilage underneath the patella, and that can help to expose that. Now, the knee has two ligaments that go like this, that cross. They're called the cruciate ligaments because, well, they cross. Cruciate is Latin for cross. Anyway, so when a patient tears their anterior cruciate ligament, it's the ligament that helps keep the knee in line. So we can test for that by doing grasping the patient's ankle and then up here, and you pull forward and backwards. And if they have a cruciate tear, then their knee will actually shear this direction and probably hurts like heck. So that's known as a Lockman's test. You're probably not going to be doing this on patients as a nurse, but you might see it performed if you work in the emergency room or in orthopedics. So, the next thing we want to do after we have palpated is ask the patient to extend their knees and then bring the knees back in. And now we're going to do it for strength. So put one hand on top of the knee, other hand like this, push out, and notice how I'm to the side so she doesn't kick me in the face. And now this hand is just going to wrap around the back and pull back. So if you do that technique here and here, it's really smooth. I've seen some people do some really bizarro, awkward things trying to assess this way. So make sure you're off the midline so the patient's not kicking you. One hand on their knee, push out, pull in. And you can do that really easily and quickly. The next thing is the ankle. So for the ankle, we have the medial and the lateral malleolus. So we're going to start in the back, palpate the Achilles tendon, and palpate around to the front. And then you also need to palpate in the anterior portion. Is there any tenderness there? Okay, so now we're going to have the patient pull up against your toes, and then I want you to roll your feet around and the other direction. Now, we're not going to test strength by putting our hand on the bottom of their foot and asking to push down, because later on we're going to have them stand on their tiptoes, and that's a much better assessment of strength. Now, if you have a patient who has a hard time walking or who is very weak to begin with, then maybe you should ask them to push down against you, plantar flex against your hand. But for your average patient, easier just to have them do tiptoe. To assess for the back, especially for scoliosis, the patient would ideally have their shirt off. We're not doing that in a video with patients that we're going to post on YouTube for millions of people, but hey. To do a good exam, you need to be behind the patient, but that's going to block your view of her back. So I'm going to do it from the side. You would be inspecting the side here, or the spine here, for straightness. And you can also use your fingers to palpate for straightness. And go ahead and stand up very slowly, more slowly. And as she stands up, you're going to examine to see if they're perfectly straight. So that's how you do scoliosis. All right, and I forgot to do the sternocleidomastoid muscle. So we'll go back and do that one. I should have done it before we moved camera angles. Now I'll never have the right camera angle. Well, why is the camera at a different angle all of a sudden?
Nobody's gonna notice what
Right.
you do.
Okay.
This is Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate how to assess the upper and lower extremities. And if you would like to watch a complete head-to-toe nursing assessment, you can access this card up here in the corner or in the YouTube description below. Now, before performing this skill, you'll want to perform hand hygiene, provide privacy to the patient, and tell them what you will be doing. So let's get started. So what we're going to do is we're going to inspect the extremities, and we're looking for any lesions, any redness, swelling, and this is a good time if they have a central line, an IV, that you look at that, make sure it's not red. Does the IV need to be changed? Does that PICC line or central line need a dressing change? Assess that. Then you can palpate, and what we're going to do is we're going to palpate our pulse, our radial artery. So feel those bilaterally, and they are 2+ and they're equal. Then we're going to check capillary refill, and to do that we're just going to press down on that nail bed and see how fast it comes back, and it's less than 2 seconds. Then we're going to check skin turgor job. Just pinching the skin and see how fast it goes back, and that was good. Then we're just going to look at the range and the motion of the fingers and the hands. Look at these joints in the hands. Do you see anything abnormal? Like for instance, like Herbadine or Bouchard's nodes, which are found in osteoarthritis. And ask the patient, are you having any pain in your hands or anything like that? No. Then you can palpate the brachial artery, which is found in the bends of the arm, and just feel those because that's another pulse site, and those are 2+. And just as a side note, if this was a patient that was getting dialysis and they had an AV fistula, you would want to palpate that and feel for the thrill, make sure that that is present up in that arm wherever their fistula is at. Then you want to test the muscle strength. So what we're going to do is I'm going to have you squeeze my fingers as hard as you can, okay? Okay, that's really good. Then I'm going to have you push up against my hands, and I'm going to push up against your arms, okay? Push. Okay, very good. Okay, and 5+ normal strength. Then we're just going to test put your hand underneath the elbow and just feel as you move the arm. Do you feel any grating, crepitus of those joints? A lot of times in arthritis, you can feel that, and move that bilaterally. Another thing you want to do with the upper extremities is to check for a drift. And what you will do is you'll have the patient hold out their arms and close their eyes, hold it up for about 10 seconds, and you're looking for a drift like this. So go ahead, do that and close your eyes, okay? And we're assessing to see if this hand will drift upward. And a lot of times, if a patient has had a stroke, okay, you can put them down, has had a stroke or something like that, you will see a drift. Now we're going to assess the lower extremities. So first what we're going to do is we're going to inspect. We're going to look at the color from the legs to the toes, making sure it's nice and pink. And here we see that Ben has a little bit of a tan line. And we're looking at the hair growth as well. You want to make sure there's normal hair growth, because in PVD, you will see hairless, shiny, thin legs, and here we have excellent hair growth. And also, do you see any abnormal swelling just right off the bat before you've even touched the patient? And look at the legs and the feet for any swelling, redness, swelling. Do you have any pain or anything in your legs, anything like that? And look at the joints, make sure there's no redness on the joints, because a lot of times with gout, it likes to start out in the big toe, so make sure that everything looks good. And then on your diabetic patients, make sure you look at the bottoms of their feet, because these patients don't have the best feeling in their feet. So their shoes could be wearing on them, or they could have stepped on something and not even know it. So inspect those feet, make sure there's no ulcers or anything like that needs to be addressed. Also, look at the toenails. Do the toenails look healthy? Or is there fungus? Or are they missing toenails? Or they have a really bad ingrown toenail? So assess for that. Next, you want to palpate your pulses. We'll palpate the popliteal pulses, which are behind the knee. And those are about 2+, they're equal bilaterally. And I'm just feeling his legs, they're nice and warm. And I'm going to push over his tibia firmly, and I'm seeing if there's any edema. So push there. And if there is edema, a lot of times whenever you push down, it's like this hard like type gel. It'll just separate and your finger will leave this indentation. And here we don't have any. Now we're going to palpate on the feet, and we're going to feel on the pulses, and I'm going to don gloves, perform hand hygiene, don gloves, and we're going to feel on the pulses in the feet. We're going to feel on the posterior tibial, and 2+, really good. And then we're going to feel the dorsalis pedis, which is on top of the foot. 2+ with that. And if you can't ever find these, because sometimes these are hard to find in patients, you can get a Doppler if you have one on your floor. Next, I'm going to check the capillary refill on his toes, just like how we did with the fingers by pushing down. And less than 2 seconds. Check the other one. Okay, now I'm going to have him push against my hands. Push against my hands, Ben. Okay, good job. Now I'm going to have you raise your legs against resistance. Good job. Now we're going to check the Babinski reflex, and you can use your reflex hammer for this and use the end of it, or you can use your finger if you don't have that. And what we're going to do is we're going to take this up through the ball of the foot and curve it, and we're looking for the toes to curl in, which would be a negative normal response. So let's check that. Okay. Okay, and that was normal. Then we're going to doff our gloves and perform hand hygiene. Okay, so that wraps up how to assess the upper and lower extremities. And don't forget to check out the complete nursing head to toe assessment video. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
जी क्लास कोई थोड़ी सी अंडरस्टैंडिंग डेवलप। अच्छा, ये थोड़ा सा था एक्सट्रीमिटीज से रिलेटेड इसकी असेसमेंट थी, और जो इससे पहले की वीडियो थी उसमें प्योरली मस्कुलोस्केलेटल सिस्टम असेसमेंट थी। मैंने लिंक को भी शेयर कर दिया ग्रुप में, और आपके पास लिस्ट भी है। आप कल इसमें जो 2 टेस्ट हैं, एक फैलन साइन, एक टनल साइन, और इसके अलावा एक बलून साइन। बलून साइन और एक बल्ज साइन लिख रहे हैं आप, और इसके अलावा टनल साइन और फैलन साइन, इनको आप देखें बुक से, और इस शीट को आप इसका प्रिंट आउट लें, ये जो डॉक्यूमेंट है, और इसको सामने रखें। बेट्स की बुक खोलें या वेबर जेनेट की खोलें, इसको गो थ्रू करें। इसको इंशाल्लाह मैंने इसका इम्तिहान जो है ना, अभी तो 14 अगस्त आ रही है, मंडे तक जो है ना, इसका मैंने आपको बताना है कि मैंने एग्जाम कब लेना है। ठीक है, कल हम इंशाल्लाह जो है ना एक छोटा सा कोई सिस्टम स्टार्ट करेंगे। इसी के साथ ही मैं आपको स्टार्ट करवाऊंगा न्यूरोलॉजिकल सिस्टम, क्योंकि न्यूरोलॉजिकल सिस्टम भी इससे थोड़ा सा एक पोर्शन जो है वो इससे मिलता जुलता है। ठीक है, उसमें बेसिकली 5 चीज़ें, हमने 5-6 एरियाज़ को फाइंड आउट करना होता है, तो वो थोड़ा टफ है। ठीक है, अगले हफ्ते पूरा वो चलेगा। ठीक हो गया ना, और सितंबर में इंशाल्लाह आपके कॉलेज खुल जाने हैं 15 सितंबर से। Anything else you want to ask from me? No sir, thank you. No sir, आप था हबीबा मैम, बट आई हैव सर वाइवा का मैम राफेल से कंफर्म नहीं। इफ्रा, आप किस में फेल हो? आईसीयू वाइवा में? उन्होंने मुझे कोई रिजल्ट नहीं भेजा ना। हाँ, उसमें कितने बच्चे 2-3 फेल हुए पड़े हैं। वो मुझे टाइम भी भेजती रिजल्ट, मैंने तो आज प्रिंसिपल साहबा को दे दिया। पता नहीं अब क्या सीन है, वाला आई विल मेक अ डिस्कस, अगर होंगी तो मैं कुछ कर दूंगा इसमें। ठीक है प्रॉफ, एनीथिंग एल्स हबीबा? आज जिस तरह आप लोगों ने क्लास ली है ना, बी अटेंटिव होके, 9 बच्चों ने बिल्कुल चौकस होके हर क्लास। ये कौन अभी गया भाई? अभी मैंने क्लास खत्म तो नहीं की। 7 रह गए। मैं 7 की 1 2 3 4 5 मैं 7 की ही अटेंडेंस भेज रहा हूँ। सिदरा जमील, जूलियस, सादिया, हबीबा वान, सहर अरूज, आबदा एंड इफ्रा। अभी मैं उठा तो नहीं हूँ मैं, 7 बजे तक आपसे एक्सपेक्ट किया जा रहा है बैठना। ओके जी सर, मैंने दोबारा लिया है। ओके लुबना, लुबाना है नाम आपका, मैं उनसे डिस्कस करूँगा मैडम से। यू आर हेयर आबदा? यस यू आर हेयर, आई नो सर, मैं भी हूँ लुबाना हूँ। आप वापस आ गई है मेरी तरफ। आप वापस आ गए। ओके क्लास, ठीक है फिर, नमाज का टाइम हुआ चाहता है। इंशाल्लाह सी यू टुमारो। ओके हाफिज़।